Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. Today, we are going to discuss about the same continuation of the 3 video set that I have made for the skin problem patient comes to you, how you will do the clinical examination. First video I have made about the history taking. Second video I have made about the physical examination, and this video will talk a very short video because the skin problems most of the times don't need any investigations at all, because this is mostly 99-95% it is a clinical bedside diagnosis. Skin problems are mostly diagnosed with the inspection, palpation, percussion, etc. by clinical examination. Okay, and history taking, of course. So myself is Professor Deshpande for paid online consultation and paid online BMS classes. You can inquire me to the WhatsApp only. I am very sorry, not phone calls because of the time restraint. 9226810630. Okay, so let us start to discuss about the investigations. When I say investigations, it means laboratory investigations as well as some other investigations. But this is done only if indicated by the history and by the physical examination. If that dermatologist, if you skin specialist, or if you general practitioner feel that this should be done, this should be checked, then you can do for the investigation. Otherwise, there is no need for any investigation. If at all it is needed, what type of the investigation we can do for the skin patients? Okay, dermatological patients, derma patients. Okay, hematological investigation, for example, hemogram and ESR. Hemogram includes the hemoglobin, red blood cell count, white blood cell count, platelet count, and erythrosedimentation rate. Okay, in hemoglobin is less, then definitely that can be a problem for getting cured for the any disease, of course for the skin problem also. So we can get the idea whether the patient is anemic or not. Of course, that we can decide by clinical examination also. Chylinicia, platinicia, there are a lot of things. Okay, but hemoglobin is a concrete objective proof that the patient is suffering from anemia or the Pandu according to Ayurveda. Acute or chronic infection, you can see for the neutrophil count. Neutrophilia is very common in acute conditions, and lymphocytosis is very common in the chronic infection. Then you can decide about the premature or immature cells in the blood, that is indicating blood cancer, tremendous high count of the WBC, etc. Low platelet count can be the cause of idiopathic thrombocytopenic purpura, purpureal patches in the skin, that is because of the low platelet count. Okay, then eosinophilia, high eosinophilia, normally it should be below 5, 0, 1, 2, 3, 4, 5, finish. But if that eosinophil count, for example, 10, 15, or the absolute eosinophil count is more, then definitely it indicates some allergic type of the pathology in the skin diseases as well. Then biochemistry, you can do the liver function test, you can do the kidney function or renal function test like urea, creatinine. In the liver function, you know that basically albumin, globulin, SGOT, SGPT, alkaline phosphatase, etc. Then you can do the lipid profile, cholesterol, triglyceride level, bad cholesterol, good cholesterol. They have the direct or indirect effect on the skin problem. Then thyroid function test, T3, T4, and TSH. Then urine analysis, urine routine, for example, to rule out the urinary tract infections or the RBC. Then it may be the hematuria, it may be the glycosuria, it may be the albuminuria. That indicates the different things. Then jaundice by bile salts and bile pigments. Serological test you can perform like VDRL or anti-nuclear antibodies to rule out the sexual transmitted disease by VDRL, or even autoimmune diseases because of the anti-nuclear antibodies. Then imaging studies you can do. For example, you can do the KOH preparation for the yeast or fungi. What they do, margin, a special super specialization dermatologists, they recommend this test, margin of scaling lesion. The KOH, that is potassium hydroxide procedure, is a method used to examine the specimens for yeast. KOH serves as an enzymatic agent which breaks down the debris of specimen such as the epithelial cells and WBCs to look into yeast or pseudophyte, okay, pseudohype. Then cytologic preparation, that is, again, you can see the smear is there. vesicular eruptions, for vesicular eruptions, direct smear base of blister for the formation of multinucleated giant cells, that is keratinocytes. Okay. Then gram stain of crust, gram stain of exudate, or gram stain of purulence, pus. Scraping with mineral oil preparation for scabies, for mite, scabies mite, eggs, or feces. Okay. Bacteriological examination, viral and fungal cultures as indicated. For example, it may be needed in the pustule, it may be indicated in vesicles, it may be when there is a problem like yellow crust. Yellow indicates the bacterial infection. Wood lamp examination for hypopigmented lesions or flexural moist eruptions. A wood lamp is a light that uses long wave ultraviolet light. When an area of the scalp that is infected with tinea is viewed under a wood's light, the fungus may glow. Fungus may glow. This test may be done to detect the presence of fungal scalp skin lesion. Okay. Special procedures, sometimes skin biopsy for histopathology, direct immunofluorescence or electron microscopy culturing the cells. Skin biopsy for other analysis, like for example, direct immunofluorescence, electron microscopy culturing the cells or tissues. Then patch test for contact dermatitis, photo test for photo eruptions. A skin biopsy is a procedure that removes a small sample of skin for testing. The procedure can help to diagnose a skin lesion, especially cancer, an abnormal area of the skin. The skin sample is looked at under a microscope to check the skin cancer or variety of skin condition or even the skin infections. Only certain skin lesions need a biopsy. Not all the skin lesions, they will require the biopsy. Patch test for contact dermatitis. During a patch test, tiny amounts of known allergens are applied to your skin. The substances are attached to your back using a kind of non-allergic tape. They may sometimes be attached to the upper arms here also. After 2 days, the patches are removed and your skin assessed to check if there has been any reaction. So it's a provocation test to see whether it's an allergic type of reaction. Photo test for photo eruptions. Photo patch testing is done by placing small amounts of chemicals on your back and exposing them to ultraviolet light. You will also test your skin by shining small amounts of ultraviolet light on your skin. So my dear friend, this is all about the skin problem patients and what type of the investigation you may have to perform. I am again repeating at the end that 95% time the skin problems diagnosis, skin diseases diagnosis, dermatological diagnosis is a clinical diagnosis. Very rarely you will require any investigations. So my dear friends, if you have any health problem, you can WhatsApp me on 9226810630. But if at all I explain any medicines in any video, I put a disclaimer that कौन सी भी बीमारी में यथावश्यक यथाकाल वैद्य की सलाह लेना बहुत ही जरूरत है. तो I request all of you once again at the end that please like this video, share this video, and don't forget to subscribe my YouTube channel. मिलते हैं इसी तरह से अगले वीडियो में. तब तक स्वस्थ रहे, खुश रहे.